Can you all see me and hear me? Another complicated head and neck topic is what we have. So, I'll tell you the thing about head and neck is that it seems difficult when you don't understand the anatomy, but once you get a hang of it, then it's really fun. Temporal bone, paranasal sinus. It looks very intimidating. Even head and neck spaces, is one of the most scary topics because so many fascia and then so many spaces. But once you understand, it's really cute. So that's how I will try and make it. And I'll tell you, when I was a first year JR, the very first, we used to have these case discussions, where every JR will have one case discussion with a faculty in one semester. My very first case discussion was a posterior cervical space mass. So this is where I was like, what is this? What is, parotid? What is carotid? What is going on in the head and neck? So that's what I first read. And there's this book called I'm sure you guys must be aware. It's a whole series of diagnostic imaging. But, the best book is head and neck. If you, I can share the PDF also with you. Just go through it. It's such a fun read. And that's what I remember, this is one of the topics that is best given in a textbook rather than any, review article. So that is what I'll recommend as a reading resource here, is that just go to the textbook. It's a really nice, easy read, So after this session, even though I've just basically borrowed a lot of images from that book, but still, if you want the PDF, I can definitely share it with you guys. Okay, so let's begin. So first of all, head and neck, right? So when we say head and neck, it's not even one topic now. So when we look at the spaces, we use hyoid as the landmark. And when we talk about the neck spaces, we say suprahyoid neck spaces and infrahyoid neck spaces, right? So those are our two. Is the audio okay? I think it's okay. Check your device settings. So basically we call it suprahyoid and infrahyoid neck spaces, right? So that's how we have to approach the masses and the spaces. So audio is not clear. Is it clear for everyone? I'm using a mic also. Mic is pretty clear. Oh, where did my screen go? 1 second. One second. Let me bring back my screen. Yeah. So this is how we're going to divide the spaces, right? The good thing is a lot of them are continuous through the two spaces. So let's approach this now. So first, a brief timer for anybody, who doesn't know anything. When we talk about the suprahyoid spaces, right? So what we have exclusive to suprahyoid, which does not extend to the infrahyoid neck. One is this space in purple. This is the masticator space, which has the muscles of mastication that help us eat. So this is exclusive to suprahyoid neck. These are two lateral spaces, right? Both sides masticator space. Parotid. We have salivary glands tomorrow or day after, one of these days, where we'll be talking more about salivary glands, but salivary gland parotid space. Again, exclusive to suprahyoid neck, lateral spaces. So these are two exclusive spaces. And this is even though it's not a fascia line space, some people call it as a space. This is the buccal space. Or if you don't want to call it space, that's better, because it's technically not a fascia line space, but this is basically the buccal fat, or it's called as retromaxillary fat pad. So these three lateral things are what are unique to suprahyoid. Now, this thing here, which is our very center thing, is what we call as pharyngeal mucosal space. This is our nasopharynx and oropharynx, hence called pharyngeal mucosal space. But when I go into the infrahyoid, the same laryngopharynx, or the larynx, is now called as visceral space, because now it's not just larynx, it's going to have thyroid also. So we don't use the term pharyngeal mucosal space, we use the term visceral space, but technically it's all a continuation of your nasopharynx, oropharynx, laryngopharynx, further going down to enclose the strap muscles and the thyroid, right? So this is what is continuous. Everything else is continuous. Fine. So this is continuous, but with different names. Understood? So we have to write it as two different spaces. All right. So this is the difference. What is same? What is same is carotid space. Carotid space, obviously the internal carotid, internal jugular is going to come from the skull base and going to go down till the arch. So this is obviously going to continue, right? There is slight difference in the content here. I let you know that right here only, but we will revise that again. So in the suprahyoid neck, the carotid space will have IJV and internal carotid, and it will have nerves from cranial nerve 9 till cranial nerve 12. All nerves are there. But when we come down, now only vagus is going to extend. Everybody else goes to their own spaces, right? So that is what is the difference in the carotid space. But both are continuous with the same fascia. Then we have this entire space, which is perivertebral space. Perivertebral space further can be divided into prevertebral and paraspinal, which is paraspinal muscles. So this thing in pink and this thing in red is again continuous, which is the perivertebral space. Okay. Then what do we have is this triangular space, which is basically in between everything, which is fat. This is very, very useful, not as a space per se, but to tell us what is the origin. What is that? That is the parapharyngeal space. Again, parapharyngeal space is going to continue. All right. So parapharyngeal space is the short space here with fat, which is going to continue down. Okay. Then there is another space which is more prominent inferiorly, which is posterior cervical space, but it is continuous. This is the posterior cervical space, again, in between everything here. This muscle is sternocleidomastoid. So just behind sternocleidomastoid, the fat is posterior cervical space. Okay. So these are the spaces that we have in total. So just to summarize everything, or not to summarize right now, but just to first slightly complicate it and then summarize it for you, let's do the fascia linings of these spaces. So in the head and neck, we have superficial fascia and we have deep fascia. Superficial fascia is useless. It is only going to outline platysma, skin, subcutaneous, all of that. We don't care about that. Our main spaces are going to be created by 3 layers of deep fascia. So यहाँ पे थोड़ा confusion हो जाता है because the names are complicated. One is the superficial, middle, and deep. So remember superficial fascia, just forget about it. Deep fascia has 3 layers: superficial, middle, and deep. What are the spaces enclosed by the superficial fascia? So here, a very easy way to remember is what were the 2 spaces which were exclusive to suprahyoid neck? Come on, tell me. Suprahyoid neck में 2 spaces कौन सी थी जो exclusive थी, which were not continuing down? The 2 lateral ones which you can see only are in the face and not in the neck: parotid and masticator, right? So both of these are by the superficial, are both by the investing layer or the superficial layer of the deep fascia. So what binds these spaces is the superficial fascia. So one is masticator space and one is parotid space. Okay. And one thing you want to remember easy is carotid space is going to get contribution from all. So it is something that I can add to all 3. Right? So very easy. Now come to middle. Middle में क्या आएगा? What was right in the center from up top, from nasopharynx, oropharynx, laryngopharynx? That was the visceral space, right? So that was either the visceral space or you call it the mucosal space. Whatever it is, this is what is going to be bound by the middle space. Now come to deep. Deep is going to be your perivertebral space. So this is what we have. In between the parapharyngeal space is a space filled with fat, which is going to run. Did you all understand? Just the names are clear that mota mota itne space hai. Now we're going to approach each of these independently, and that's how we have to approach it. So let me repeat with an image so that you have a picture, because so far did theoretically. Can you see this yellow line here? Yellow line here is the superficial layer of the deep. Okay, understood. Every time now we are saying deep only. So I will not say superficial layer of deep fascia. We mean superficial, middle, and deep of deep fascia only from now on. Okay, so this yellow is the superficial fascia. So you can see that this yellow fascia is making the masticator space. This is my masticator space and this is my parotid gland. So can you see yellow color here? Apart from that, the superficial fascia also is going to outline my main muscles. My main muscles, which are trapezius here, and as I go down, sternocleidomastoid. That is what is yellow superficial fascia. Understood? Now come to middle. Middle का क्या काम था? ये वाला part, which is my mucosal / visceral. Upper pharyngeal mucosal, niche visceral. Alphabetical order. That's how you remember it. So you can see this purple lining. Purple lining is my pharyngeal mucosal space. You can see here, this is nasopharynx, oropharynx, like that we will be seeing. Okay, so this bulge here is the bulge of the nasopharynx. Fine. So this is what we have as the middle layer. And the deep layer, see this light blue color? Light blue color is this perivertebral space. All right. Now, two things which are in between. So one thing which is in between here is the parapharyngeal space filled with fat. The other thing which is in between here, which I'm coloring with green now, is the retropharyngeal space. As the name says, retropharyngeal space is behind my pharyngeal mucosal space and in front of the perivertebral space. We will expand on that, but right now I just want you to remember RPS and PPS. Both are going to be continuous again from up top till the infrahyoid neck. Okay, and what did we say about carotid? Can you see they are getting contribution from all three colors? So that's the easiest thing to remember. Fine, are you understanding little bit? And then this is my buccal fat pad, which I call as buccal space. Okay, little bit you have understood. So now we come to radiology. So this was the schematic anatomy. Just be with me. You will understand by the end. If you're not understanding right now, it will seem very easy. Okay, when we take it one space at a time. So now there are three corresponding sections of the CT, which are gonna, tell you about all of the spaces. So now I will ask you guys, okay, I'm gonna encircle a space and you guys without reading answer, tell me what space have I enclosed? What is this space that I have enclosed here? Easy. So you can see the mandible and then you see the muscles. Good. So this is the masticator space. Now in the masticator space, what do we have? Let's do it right now only. We have the muscles of mastication and we have the mandible here. So what are the muscles of mastication? You know the superficial. Do this. When you do this and you palpate, this is your masseter muscle. So this is masseter. Then the muscle which are deep, you can't palpate them. They are your pterygoids. So medial pterygoid, lateral pterygoid. So obviously you know that medial pterygoid is going to be here, medial to the pterygoid process, lateral pterygoid is going to be lateral to the pterygoid process, right? So I can guess both of these muscles. Then I have temporalis. Temporalis is, as the name suggests, temporal. It's going to go up, right? So this is one thin temporalis, which tends to go up here. Okay, so these are my muscles of mastication. This is my mandible. And one more thing, can somebody tell me which nerve lives in the masticator muscle? Which nerve supplies masticator muscles? Anatomy, trigeminal, right? So it is V3. It is the V3 mandibular division of trigeminal, which also lives in the masticator space. So this is my masticator space. Clear? Now tell me, what is this space here? What is this space behind the masticator muscle? Behind. This is the parotid space, right? So this is my parotid space here behind my masticator muscle. Okay, so this is parotid. Parotid space has parotid gland. Okay, so that's all that I need to know here. We will see the details, what lives within parotid gland in a while. So this is parotid space. Now come to the center part. The center part where you have air, you have some boundaries of muscles, you have some bulges. This is my pharyngeal mucosal space, which will go down as visceral space. Then come to vertebra. So around the vertebra, we have the perivertebral space, and in between, I'm going to have retropharyngeal space. And this is my carotid. This is my carotid space. And what is this bone here? This bone here is the styloid process. Okay, so grossly speaking, are you comfortable with all of the words which are written here? Yes, you are. And this fat pad here is retromaxillary fat pad. Okay, so you will be comfortable in a while if you're not comfortable. So this is my suprahyoid.